So here we are going to discuss the key parameter that characterizes the function of heart, and that is cardiac output. We will determine the discuss the factors that determine the cardiac output, and then discuss what increases or decreases the cardiac output. So cardiac output is stroke volume multiplied by heart rate. This is one of the most important equations that you may learn. And now we can ask, how is stroke volume and heart rate affected? So stroke volume is dependent on venous return, according to Starling law on heart, on the contractility of the heart, and peripheral vascular resistance, also referred to as afterload, and venous return is referred to as preload. So, and the heart rate is determined by two aspects. One is automaticity, and that depends, the heartbeat depends on a pacemaker activity, and if it's sinoatrial node, it's about 70 per minute. But if other parts of conducting system on the heart need to take over, the pacemaking activity may be different. For example, nearly half of the heartbeat is achieved by atrioventricular nodes. But heart rate is also affected by autonomic nervous system, by sympathetic and parasympathetic nerves. So first, let's discuss the effects of venous return and to ventricles and contractility on the cardiac output. So if we focus on the black curve, that's basically the Starling law on heart, which is showing us that the more blood is in the ventricle, left ventricle in this case, and the more is ejected. So the stroke volume is higher, right? So if you increase the volume at the end of diastole in the ventricle, the more is ejected, and that depends on the position of actin and myosin. So they are a little bit more apart when there is more fluid, and therefore more is ejected from the ventricle during systole. Now, you see here also other curves, and the green curve is showing an increase of contractility. So the same relationship as described here is now at higher level. And so when we have increased contractility, the same end-diastolic volume in the left ventricle is going to lead to an increased stroke volume, because this heart has higher contractility. This can be achieved by exercise, by giving some inotropic medications, or for example, caffeine, right? And when our body is responding to a situation where the cardiac output needs to be increased, both things happen. So increased venous return will bring us here, but also increased contractility, when it's added, will bring us here. So then we said that the cardiac output is also affected by the heart rate. And here you see the impact of sympathetic system and parasympathetic system on the pacemaker's activity, right? So here we have the action potential of a pacemaker, usually sinoatrial node. And when a sympathetic system is activated and gives signals to sinoatrial node, these action potentials are occurring faster, and you see here that the slope of this curve is steeper, while when parasympathetic is calming down synatrial node, the slope is flattened, and there will be fewer heartbeats in the of the heart. So another very important aspect of the stroke volume is peripheral vascular resistance, right? So peripheral vascular resistance is primarily dependent on diameter. So here you see an Ohm's law determining the differential in pressure depending on resistance. And here we have it recalculated for the situation that is relevant to the physiology. And you see here that the resistance is higher with increased viscosity of the blood, the increased length of the tube, but particularly with decreased diameter. So a small change of a diameter, for example, by a factor 2, will lead to a huge resistance in resistance, because you have here the exponential relationship. So change diameter by factor 2 means a change in resistance by factor 16. So that will then increase the blood pressure, and the heart has to work against the large resistance. Now, what are the most common reasons of increased, I apologize, here should be increased arterial resistance? One is stress that causes vasoconstriction. So it will cause higher resistance, or longer term factor, which is atherosclerotic plaque, which causes remodeling of the artery and a reduction of the diameter. So the cardiac output can be increased or decreased. So it will be increased if heart rate is increased, if more blood is brought to the ventricle, so increased venous return, or there is an increased contractility. So all these three aspects can be achieved by enhanced activation of sympathetic system. The cardiac output will be also increased if there is a decrease in peripheral vascular resistance, if there is a vasodilation, right? Now, the cardiac output will decrease if the heart rate, venous return, and contractility are decreased, but it will be also decreased when there is increased vascular resistance, as it's mentioned here in these two cases.